Hello, my name is Mary Esther-Gilbert, back again to my channel. Welcome back, everyone. Um, this is for the True Health Mastery Institute of Holistic Personal Health Management, the information that I share with the public and also with private conversations with my institute members. So tonight, I'd like to talk about what it takes to maintain strong bones. And as people age, then their bones get weaker and more porotic or porous. And so tonight I'm going to show you a few things you can do to maintain your bone mass as you age. This is also happening to younger and younger people. So this is not something that is new. It's been a problem in the population among young athletes and growing bodies that they're just not getting the nutrients they need to properly nourish their bodies so that they can develop strong bones and develop in other ways as well. Growth and development is so very important for our youth, and it's also important for the later years because that determines how well you can hang on to your bone mass. Unless you do a few things that I will share with you tonight that has been shown to help people recover a lot of their bone mass. So let me show you a few things here. I'm going to share my screen and bring up my document for you. Okay. All right, so this week's topic is about the vanishing bone matrix, reversing bone loss, restoring bone density. So the critical nutrient complexes that protect and maintain living bone tissue, we'll be talking about that. We'll be talking about the mineral imbalances and their adverse effects on the bone glandular or hormonal interactions in the body. I'm going to be offering you the no side effects solution, exercises and nutrients that stimulate bone growth and prevent bone degeneration at any age. Avoiding the side effects, what medical teams feel so helpless about knowing that the medicines that they're prescribing have side effects. So I will show you a holistic approach, a cellular nourishment approach, very scientifically backed, and I will give you the science and I'll show you just what it takes to maintain your bones. So the body's amazing skeletal structure. Our bones are a multi-purpose, highly dynamic, metabolically active and protective structure of living tissues. So as you can see in this photo or this image, the normal bone matrix should look like this. It's porous and it absorbs nutrients and allows fluids to come in and out, and it allows the immune cells and red blood cells to be to exit the bone tissue and enter the circulatory system. So this is a dynamic interplay between what's being absorbed into the bone structures and what's being released out into the bloodstream. So there's got to be a balance there. So on the right there is a person who has osteoporosis. So over time, the bones lose a lot of their minerals, so that matrix gets more and more porous. So the skeleton provides structural support for the body. Without our skeletal system, we'd just be a heap of protoplasm. Allows movement and motion. So as you can see in our joints, we can move our wrists and our joints, all different directions, and also allows us to just go forward and, just move around and not be hindered by should not be hindered by any stiffness or lack of balance or anything like that. So it's actually a reservoir of calcium, phosphorus, and mineral ions, negatively charged ions. That's very important to maintain in our bone structure and in our bloodstream. It protects major organs, the brain, the heart, the lungs, and the kidneys, because it provides, it's like a reservoir of minerals, and it provides these organs with the minerals that they need to function properly. Also, it provides the circulatory system with calcium for all the cellular metabolic processes, our multiple trillions of cells, and there are even more multiple trillions of biochemical processes that go on at the microcell level. So calcium is very important for all of those processes, along with other minerals, of course. Also, bone regulates calcium and phosphate. And so phosphorus is another very important mineral for maintaining bone mass. All right, so, and it prevents deficiencies and imbalances. So also, the bone actually produces estrogen. It's a hormone normally associated with females, but it's actually a key regulator of bone turnover. So when your old cells get old and the body has to get rid of the old cells, new cells take their place. So this turnover is constantly going on. And so maintaining the minerals and a balance of hormones is very important to maintain that bone structure. So the estrogen hormones that the bones produce are surprisingly both for males and females. So the estrogens, these hormones, are like steroidal compounds that are produced in the body. They're derived from cholesterol. So cholesterol is not a bad thing. It's the fried oils that get stuck to the arteries and cause damage in our blood vessels and clog things up in the body. Cholesterol is something the body makes, and every single one of our trillions of cells, their structures are made out of cholesterol. So we need cholesterol. It's been given a bad rap for too many years. So now is the time to come out and tell the truth about it. So the estrogens are made from cholesterol. Now, cholesterol is a precursor for thousands of hormones, as are other nutrients that I'll be talking about tonight. So it's now acknowledged that estrogens are the key regulators of bone formation or bone remodeling in both genders. So bone remodeling just means that you're constantly replenishing your minerals in your bones and forming new bone tissue at all times. So here are about 4 of the different types of estrogen hormones that the body produces. So the 17-beta estradiol, also known as E2, now keep E2 in mind because I'll be bringing that up shortly in another area here. That has high biological activity, a high binding affinity, and biological activity with cell estrogen receptor sites. So our tiny microscopic cells, they all have this plasma membrane, and on that membrane are these receptor sites to accept information, nutrients, and to allow things to go through that membrane into the inside of our cells so that our bodies can maintain our aliveness. Everything happens at the microcell level. Energy production, protein, rebuilding new protein tissues, all of that starts at the cell level. So this very important estrogen has a lot of things to do in the body. And there's also estrone, which is also labeled E1, and that's produced during menopause. And the other one is estriol, also called E3, is released during pregnancy by the placenta. So all these hormones are coursing through the body all the time. So estriol, which is E4, is synthesized or made by the liver inside of the fetus, inside the forming baby in the mother's womb. So let's talk a little bit more about the 17-beta estradiol, or E2. That's a very, very important hormone. In women, it's made in the ovaries from puberty to menopause. All throughout people's lives, up to menopause, this hormone is being produced. And it's responsible for the development of primary and secondary sexual characteristics in women. It's also produced in men, where testosterone is converted to help regulate the hypothalamic pituitary gonadal axis. So this trio of glands are working to help men produce the estrogen E2, and that is for their bones, right? Okay, so the I can't even say it tonight, hypothalamic pituitary gonadal axis. I'm going to enlarge it here so that you can see it better. So this is just a really simple, rendition of what happens. So in the brain, there's these little, ball type things that's called the hypothalamus. So we've got these pituitary glands here that will produce these different types of hormones. So in men, the testosterone is produced, and in women, it's producing luteinizing hormone, LH, or follicle stimulating hormone. So we've got all these different hormones going on, and all these different cells that are involved in the male and in the female. So then, as they go into the making of sperm, then we have these tubules that are forming the sperm, right? So testosterone is involved, and the estrogen is also involved in this process. And all the while, the bones are being maintained and minerals are being deposited in the bones with the help of this E2 estrogen. So bones determine the height and stature in longitudinal and width growth and development of bone tissue. So how long the bones are and how thick they are, how wide they are, is determined during childhood and puberty. So when you're nourishing your child and your teen, make sure that they're getting enough minerals, especially calcium. So this determines one's resistance against fractures in advancing age and the elderly. So the better, your child is nourished, and the stronger their bones are as they're developing and growing and lengthening, then the less chances are that someone will have, just weakening bones when they're older. Also, the bones produce red blood cells. So that's where blood cells are born. So, you have to stay nourished with all the nutrients that help your body produce the blood cells as well, and then some. So we have the disease of degenerative bone loss. Notice I put the word disease in quotations. There's just so much controversy about this term out in science and the medical field and the competition of the holistic community. So this is a very touchy word. So when you lose your bones, it's a matter of losing the nutrients that's required to maintain their strength and thickness and lack of porosity, right? So I don't know if that should be considered a DISEASE. So I'm on YouTube, so we have to be careful sometimes to not get turned off for a week. They like to punish people and turn us off for a week and not allow us to post anything. So it's just it's a progress in motion as far as our freedom of speech and what we can and cannot say right now. It's getting better. I hear a lot of people are getting their channels back, their YouTube channels back, after being banned for a couple of years or longer. So something's happening in the YouTube world. They're actually starting to kind of backtrack on their strictness, right? So anyhow, that's another subject altogether. So anyhow, we'll talk about the degeneration of bones. So now there's terminology here that I think people should just get familiar with if you're not already familiar. Osteoporosis or osteopenia. Now that's defined as low bone mineral density, also abbreviated BMD, resulting from altered bone microstructure, predisposing patients to low impact fragility fractures. The physical exam rarely reveals any changes until osteoporosis is already in its advanced stages. Indicators are loss of height and kyphosis, which means spinal deformity, that hunched over posture, which becomes evident due to vertebral fractures in your vertebrae. I mean, it's amazing people survive vertebral fractures without getting paralyzed, right? So then we have osteogenesis or ossification, and that is the development and growth of bone, and that's referred to as osteogenesis or ossification. Some skeletal bone begins to form during the first few weeks after conception. After 8 weeks, cartilage and connective tissues will have developed a skeletal beginnings where the process of ossification begins. So once cartilage turns into bone in these first developmental weeks after conception, then that's when the fetus can, or the baby inside the mother, can begin to accumulate minerals in the bones for growth and development and elongation and enlargement of the person, right? So bones continue to develop throughout childhood and adolescence and throughout adulthood in its capacity to repair fractures and remodel or build new bone. So hey, I can play this video. It's not going to have sound on it because I forgot how to turn on sound on videos. But I'm going to go ahead and actually, I don't think I should play it because I think that is one of the rules that YouTube has, that you can't play videos. But what this shows, and this will be, this video will be on my YouTube. Well, you're watching it now on my YouTube channel. This is after the fact, right? I'm recording it right now, but this is you in the future watching the video. But if you follow this link, you can watch the video on your own computer. Okay. I will probably put this, you will find this link in the description box below. How's that? It's very fascinating because it gives you a real life, it's like a computerized animation of what it looks like when new bone is being formed and bone is being released back into the system where it's needed. So yeah, we'll talk about that imbalance too, because things can go wrong about that imbalance. So let's look at some statistics. Over 200 million people have osteoporosis. 250 hip fractures occur per year with a mortality rate of 20%. And those are just, in my opinion, unnecessary deaths. And it's so tragic. Incidence rates increase with age. It affects over 70% of people over age 80. And it's more common in females than males because we have less bone density than males. Worldwide, approximately 9 million fractures per year are due to osteoporosis. 1 in 3 females, 1 in 5 males over 50 will suffer an osteoporotic fracture. That is not a good statistic, is it? 1 in 3 females and 1 in 5 males, anyone over 50, we can do better. Men with hip fractures have higher mortality rates than women. Patients who are immobilized can develop complications such as pressure sores, deep vein thrombosis, that's a blood clot or thrombus that forms in one or more of the deep veins in the body, usually in the legs, and nosocomial, which are infections that occur during hospital stays. So areas of the world closer to the equator have more sunlight and therefore are less fracture rates compared to those living in lower latitudes. Those who receive more sunlight have more synthesized vitamin D in their systems. The body makes vitamin D when you're out in the sunlight, and that is a precursor for lots of hormones the body makes. So it provides the precursors for the manufacture of the body's 10,000 hormones or more. It aids the capacity for more effective immune cell actions, and it promotes bone density. So vitamin D is extremely important for promoting the strong bones and to fill back in the minerals that have been taken out over time so that a person can remodel or grow, their bones back, get their bone density back. So there's things that stimulate this process, though. It doesn't happen automatically. All right, so I will be talking about that. Now, there's different types of osteoporosis. The primary osteoporosis type is when we have loss of bone mineral density and fracture risk factors. So that means it relates to decreasing sex hormones, and it increases with advanced age. And also it happens in mostly females. And it happens in people with a body weight under 128 pounds. But someone who's under 128 pounds and who exercises and eats the right foods that replenish bone and other, nutrients that replenish other tissues in the body, then the weight isn't such a scary, number, because if someone of my stature were to gain to 128 pounds, I'd be overweight. But someone who has, a larger stature is going to may even be underweight at that, at that weight. So it varies and depends on the body, and it depends on what kind of exercises you do. And I'll cover that shortly. So excessive body weight is associated with the wrist and arm fractures of, people who are obese and they are becoming osteoporotic, then they're more prone to breakage of the wrists and the arm. Also, smoking and alcohol intake will contribute to osteoporosis, and a family history of osteoporosis is also a factor. And also it happens statistically in the white or Asian races. Why that is, I don't know. People who live in colder climates, tend to be of the Caucasian persuasion, and maybe they're not out in the sun often enough and they're not getting enough vitamin D. That's one factor, that's one possibility. The Asian race too, a lot of the countries have severe winters, so half the time or more, they're not exposed to the sun, and they're also in the higher atmospheres, or not atmospheres, but higher areas of the earth where the sun does not shine as much as it does in the, like say, at the equator. Okay, so also it happens in early menopause. If someone has little exercise, low physical activity, and they have a personal history of broken bones before, limited mobility because of spinal cord and other injuries. So if someone is not able to mobilize their body, not twist and turn and move freely, then they're more prone to osteoporosis as well. So secondary osteoporosis or rapid bone loss is caused by various things, medications like the glucocorticoids, the anti-epileptics, and the thiazolidines, and also chemotherapy agents, if someone is under chemotherapy, and also amenorrhea or irregular menstrual cycles, and also non-estrogenic hormonal therapy, anybody who undergoes medical hormonal therapy, low body weight, low body mass index. So low body weight and low body mass index indicates that the person is underweight. Also excessive exercise. If you're not replenishing nutritionally and resting and rehydrating and getting enough sleep between your workouts, then you're more prone to osteoporosis as well. So there is always a balance between exercise and nutrient replenishment, hydration, all those things that people tell you to do when you want to get in shape or get, stronger and look better, right? But a person can overdo it. And so there has to be a line drawn between what is excessive exercise. If you overdo it once, then of course that you can recuperate from that. But if you're chronically obsessed with exercise and you're always wearing yourself down and you're not recuperating properly, then you're going to be, subject to or at risk for osteoporosis. So then let's find out the cause of osteoporosis. Now, it occurs when there is an imbalance between normal bone resorption and bone formation or modeling, leading to decreased skeletal mass. So bone resorption, that means it's the breaking down of bone tissue and it's being released into the bloodstream. Okay, and so your body needs calcium in other areas of the body, so it dips into its reserves in the bone in order to distribute the minerals, especially the calcium, to other areas of the body. Calcium is used in every single one of our cellular processes. We need calcium always there. Bone modeling, it occurs throughout life where mature bone tissue is removed from the skeleton, or bone tissue that becomes old and spent. The body's always turning over and making new cells, gets rid of the old and makes a new one in its place. And so also new bone tissue is formed by the osteoblast cells. So we have osteoclasts that are breaking down bone tissue, and we have osteoblast cells that are forming new bone tissue. So smoking or history of smoking puts you at risk. Chronic alcohol consumption. Alcohol, if you haven't seen my video on alcohol on this channel, please view it. If you're a light drinker and you're generally healthy, then it's not so bad. Alcohol has tremendous damage. It does tremendous damage in the body. So if you're a chronic alcohol drinker, please watch that video. And it's more damaging than you could ever imagine. So family history of osteoporosis, prior fractures after age 40. Okay, so you have prior fractures when you're younger, and the bones do heal, but for some reason statistics show that people who have had fractures before are actually prone to osteoporosis, and fractures after the age of 40. Other conditions that cause bone degeneration. So things like hyperparathyroidism, that's the overproduction of the parathyroid hormone in the thyroid gland, are called PTH, resulting in abnormally high calcium levels. Okay, so if your parathyroid glands are overproducing and overreacting, you're going to have abnormally high calcium levels, and that can affect the kidneys. That can form kidney stones, and you can have other problems, which leads to other kinds of diseases. So also, anorexia, of course, if you're starving yourself out there, if you have anorexic tendencies, please get help. Please know that you are a beautiful, wonderful person, and it's important just to have a realistic view of your body and to understand what nutrients are doing for you, not against you. So, and it's the type of foods also. A person can eat a lot of healthy foods like the plant kingdom, all these wonderful fruits, vegetables, herbs, whole grains, beans, and legumes. It's wonderful, wonderful, nourishing, cleansing, health building plant kingdom. And of course, the animal derived proteins, because we're made out of almost entirely out of protein. So we need those kinds of proteins in our bodies to constantly rebuild our cells and make us look strong. And even those who exercise have great physiques, right? If they're eating properly and replenishing nutritionally, getting the rest they need and spacing their workouts properly and just putting them all in perspective, then they're going to look fantastic, right? So just get the help you need if you really need the help. Talk to someone. Just have your loved ones show you that they love you. Okay, so that's so important out there. If anyone has someone with this condition in their family, please provide love and care and attention and hear them out and, just work with them in the loving way that they so desperately need. All right, so again, that's a whole nother video, isn't it? So then we have malabsorption. People who don't eat right are going to not be able to absorb nutrients if they have any nutrients in their diet as well. If they're eating junk food, overly processed food, fried foods, things that the body just does not know what to do with, and it in fact causes inflammatory responses, clogs the whole system, you're not going to absorb any kind of nutrients. And if you've been abusing your body that long chronically for a long period of time, your digestive system will have been damaged, and so you won't be able to absorb nutrients if you are eating healthy. So malabsorption has to do with so many different problems. So you're just sticking to a super healthy diet. Half your diet should be in the form of raw plant foods, and the rest should be quality proteins and whole food carbohydrates, starches in their whole food form, and try not to eat anything refined or processed. And that would be so much better. You'll see how the body just shifts and starts utilizing these nutrients and just becoming more and more efficient at nourishing you. So malabsorption is because of so many other things too, so we won't go into that, but that's one of the things that cause bone degeneration. Okay, so hyperthyroidism or overtreatment of hyperthyroidism. So talk to your medical people and ask to see the side effects of any medications you're on, or if you've been from doctor to doctor, just try to get them to communicate with each other, because many times they'll prescribe and overprescribe, and the tremendous accumulation of side effects is going to be quite dangerous for you, So those side effects are not nourishing, and they are not going to restore your body to its proper functioning like nutrients do. So the thyroid gland is when it produces too much thyroid hormone, it could be because of autoimmune diseases, non-cancerous thyroid nodules, inflammation of the thyroid, known as thyroiditis. Anything with the ending that says itis is going to be something regarding inflammation, excessive iodine intake, and people who take individual vitamins or individual minerals are going to have tremendous side effects. So these complexes work best when they're in their whole food form and they work together in synergy, because the body does not use one nutrient at a time. It uses whole complexes, the full range of nutrients, in order to regenerate and protect itself and build itself properly. All right, so excessive thyroid hormone medication, pituitary tumors in rare cases. So I have to once again mention that all of my work is due to diving into that scientific peer-reviewed literature that is so predominant in the scientific world. Groups of scientists get together and they perform their experiments and their studies and their research, and they produce their results and their reports, and they publish them to these scientific journals, which are in turn featured on government databases or responsible organizational databases as well. So if you want to know the truth about how your body works and what nutrients it needs, then your search terms should always, when you Google something and you type in a search term, how does this particular nutrient work, or how does this botanical work in the body, always type in the word science journal after your search terms. That way you bypass all the propaganda, you bypass all the misinformation and the disinformation out there, and you bypass all the people trying to convince you to buy their products because their products are the best and the only be all and end all to help you with your problem, which is not true at all. So you can bypass all of that baloney and go right to the scientific research, which is considered the most credible information in the world, because these are scientists from all over the world that are reporting and compiling their data and putting it and posting it on these sites like the National Institutes of Health is one tremendous database where you can find many scientific articles. Okay, so it takes time, to get used to the terminology in those articles, but you will get used to it. And usually when you look at the introduction describing what the scientific research report is about, and also at the conclusion or the discussions, are kind of worded more for less science-oriented individuals. So if you feel comfortable doing that, or if you are science oriented, then by all means read the whole body of the report, and you'll be fascinated, and you'll learn so much about how nutrients work in the body and what the amazing outcomes have been in these kinds of studies. So also, other conditions that can cause bone degeneration are chronic renal failure, chronic kidney failure, and something called Cushing's disease, secondary amenorrhea, lasting over a year. So if you've had menstrual issues that last over a year, then that is going to cause a lot of bone degeneration as well. So taking these countermeasures that I'm going to be talking about is so extremely important. So also, one thing I've always done is I've helped my clients look at the side effects of their medications. And I've always tried to work with the medical doctors in the past to let them know that they are seeking nutritional help, and to let me know if there's any contraindications in, a basic whole food, well-balanced, high nutrient rich diet. So in the early days, doctors would not be very courteous about that. They did not understand, or they did not like what, I would try to communicate to them about their patients. So they were my client, and my client had a choice to notify their medical people or not. That was just their constitutional right, God-given right. So I had them just sign waivers and just to make sure everybody involved was clear as to what I was doing for, their patient or their client. So so these are the side effects of anti-resorptive pharmacologic treatments. So in other words, there's some drugs out there that will prevent the release of calcium and other minerals from the bones into the bloodstream. I'm sure they have their reasons, but they are upsetting the balance between allowing the body to receive the minerals from the bone reserves and also receiving enough nourishment so that the bones can uptake the minerals and maintain their structure, their bone density, right? So some drugs reduce the risk of fracture at vertebral and non-vertebral sites. Some drugs require immediate follow-up treatment with another agent, in other words, another drug, to prevent bone mass loss that occurs quickly after their discontinuation. So they'll give a person a drug that will help them with making sure that they reduce their wrist fractures in certain areas. But then once they take them off that drug, they have to follow up with another drug to prevent any bone mass loss that's going to occur quickly after they can discontinue the first one. All right, so that's all I can say about that at the moment. Some anti-resorptive drugs or anabolic agents ultimately inhibit osteoclast resorption and induce osteocyte apoptosis or destruction. Okay, so the drugs are not allowing the minerals to be released into the bloodstream, right? So they're going to inhibit this process with the osteoclasts, and they're going to inhibit their resorption into the bloodstream and induce osteocyte apoptosis, which means they're going to cause a lot of these bone cells to self-destruct or be destructed or destroyed. So osteoclasts are cells that are involved in bone resorption and releasing minerals like calcium in the bloodstream, like I said. And the osteoblasts are bone-forming cells. So it's important to get those two straight, right? But the osteocyte is the cell itself, the bone cell that's forming in the bone itself. So those are the cells in the bone matrix that are the sensors for coordinating bone remodeling or forming new bone. So the body's constantly monitoring itself. It's constantly sensing what's going on in the system. When some drug agent medications are stopped and hormonal therapy is involved, follow-up treatment with another drug agent is required to prevent rapid loss of bone mass. Again, they're taking all of these hormonal therapies that can also cause rapid bone loss unless that intervention by applying another drug to prevent that bone loss from happening. So bisphosphate prolonged use beyond a 3 to 5 5-year period is cautioned against possible potentially morbid adverse events. So bisphosphate, is related to the mineral phosphate. So patients must be made aware of and report any symptoms of thigh discomfort. Risk of osteoporosis can be decreased if exercise and a calcium-rich diet is implemented. Again, a calcium-rich diet doesn't mean isolated calcium. It means a whole food complex of foods grown in nutrient, mineral-rich soils that have plenty of calcium in the plants. That's the best form of minerals that your body can understand and absorb and readily be made available. So it also increases risk for hip and vertebral fractures in postmenopausal women, leading to kyphotic posture, bent over posture. Increases risk of chronic pain, respiratory impairments, and a high risk of developing pneumonia. So obviously it's going to affect the immune system as well. So let's talk about exercise. Exercise, it affects bone density and increases the bone density and allows the maintenance of the bone, strength. So regular exercise, it produces stress on muscles and bones, also called mechanical loading. When you're lifting weights, you're putting a load while you're moving your body mechanically, right? Which stimulates a growth response. So your body's very responsive to exercise. It anticipates the next workout. So what does it do in the meantime? It stores nutrients, it repairs things, right? It gets itself ready, physically psyching itself out for that next physical challenge, right? And that's what progress is. Fitness progress is getting the body to get stronger and be better at utilizing nutrients that you give it. So it increases exercise, increases muscular size and strength. It also, any increase in mechanical load placed on bone puts strain on the whole bone. So it's not like you're going to, if you're doing squats or bench press or just, moving light weights around, ladies, if you're new to weight training, or if it's been a long time since you've lifted, and you do have osteoporosis. So, very, very light weight training increases that circulation and stimulates the growth response. So anything like that is going to be beneficial. So this stimulates the uptake of minerals into the bone matrix. It increases calcium deposition into the bones, making bones denser and stronger. The building of bone density and strength during childhood and adolescence extends into their capacity for better bone mass in later years. To repeat myself, but that's okay. The process of bone deposition and normal resorption actually occurs in the fetus and continues until the epiphyseal fusion, that's the end of the bone length, to about the second decade of life until they're about 20 years old. So this is a picture of this process, this epiphyseal fusion. So on the left side, you see these, so you're looking at, on this one, you're looking at the knee on the right side and the back of the knee on the left side here. So here's the femur bone, the big thigh bone, and here's the tibia or the calf bone, right? And here's the joint right here where the knee can be bent, right, and straightened out. And so, and here's the tendon called the patella tendon. So there's a tendon that holds these two bones together, and the muscle structures on there, holds it all together. But the growing person is going to have the separation of their bones right here. And so, and then later on, once the bone becomes more calcified or ossified, then it's going to close up and be part of the whole bone. All right, so now on the right side is an actual x-ray of this very thing that has already happened. Now, this is an 18-year-old person where the bone has already filled in the minerals where it had to elongate and stretch, right, and fill in more minerals so that it can be longer. Same thing with the bottom part here, and same thing with the other area of the calf back here, the other bone here. So lifestyle is one of the main factors for developing maximal bone health throughout life. Physical activity and the daily intake of calcium, along with other minerals, are the major factors that determine one's bone mass, from late childhood continuing throughout the later senior years. Okay, but it's never too late, seniors. I'll show you why. So exercise influences bone mass when calcium and other minerals are present. So physical activity and calcium do not operate independently, since building muscle strength affects the building and maintaining of bone mass or bone mineral density. All right, so yeah, you need exercise and you need the minerals. You don't do one without the other. You've got to do both in order to stimulate that uptake for stronger bone density. So an adequate supply of calcium and other synergistic minerals maximizes exercise benefits. Now, exercise will aid in the rapid bone growth response in children and teens. As they're growing, they're going to take up even more minerals and have even stronger bones when they're exercising. Bone density and growth and development in early years minimizes risk of osteoporosis in the later years. There it is again. And these are different scientific research studies that, I'm summarizing here. So naturally, they have come to the same conclusion. So if it seems redundant, that's why. So physical inactivity results in a decrease in bone density and muscle or lean body mass and overall essential body protein. So when you decrease in your bone density, that also is coincident with decreasing in muscle, when you're not exercising. And so your muscles just start degenerating and atrophying, getting smaller, and there's no need to have big muscles if you're not going to use them, kind of thing. And also the rest of your body, to reduce the body fat, it takes exercise, but you start accumulating the body fat, and so you have less lean body mass because of the degenerative effect and also because of the increase in body fat. So, overall essential body protein, if your body's not active, then it's not going to want to produce new proteins necessarily all the time, right? Not nearly as much. You need that to stay alive, obviously, but not to maintain a very fit and healthy, strong body. So that makes someone more prone to bone injuries and more prone to muscle and connective tissue injuries. So everything gets weaker. Being sedentary also leads to sluggish circulation, leading to poor distribution and utilization of nutrients. Poor circulation means you're not getting nutrients distributed to all ends of the body. Poor oxygenation and hydration of tissues at their cell level. So that also means your body cannot uptake water as well. to hydrate you. Poor detoxification, waste removal that should normally occur daily slows down as well. So your body gets more toxic and your body can't get rid of these metabolic wastes. So you're going to have diminished energy levels. Once the system is circulating poorly and it's not able to absorb nutrients properly, and it just kind of sits there and cools, and you feel sluggish and everything in the body becomes more sluggish, then of course you're not going to have enough energy for anything. So weight-bearing exercise and bone mass. Now, weight training has always been a favorite of mine because that has done so many things for me. And when I used to train people back in the 80s, I saw transformations like you would not believe, from weight loss to just transforming their figures to having more energy and being stronger and suddenly realizing that they can actually participate in sports and they didn't know they were able to ever before, kind of thing. So it's kind of a wonderful thing to see this kind of fitness awakening in people. So weight bearing has been shown to be very beneficial for all ages, depending on, of course, it's depending on the age, then the amount of weights a person uses is going to matter, right? So, research study on the effects on weight-bearing vertical jumping exercises, and here's a study that was done on premenopausal and postmenopausal women and men. So, for the premenopausal women, they had an increase in femoral bone mass density. Their thigh bones increased in bone mass from jumping exercises, vertical jumping, right? And then the postmenopausal women who had already gone through menopause, had no bone mass density improvement. So what does that tell you? That tells you that the ability to create new bone mass was diminished in people who had already gone through menopause. It was attributed to a reduction of circulating estrogen levels and loss of estrogen receptors on bone cells. So how do you re-stimulate that process? It's continuing with the weight training over time and making sure the body gets plenty of the full range of nutrients, including the right types of minerals. Vitamins and minerals are so important for this. And also plant chemicals. Many of the plant chemicals in the plant kingdom called phytochemicals or phytonutrients also have been shown to help put back the strength and density of bones and other areas in the system. So estrogen deficiency leads to increased osteoclastic bone resorption. Okay, so you don't want too much of the minerals being released from the bone into the bloodstream. Estrogen regulates and prevents bone turnover in both women and men. So it's important to have the hormone estrogen. Now, I know that it's not a good thing to go out and just try to take estrogen all by itself. And even some medical procedures admit that there are some side effects to this. So you don't want only that one hormone in your body all the time. It's not going to do the job that you hope it's doing, right? So there's only one way to actually produce the right amounts of hormones, including the estrogens, and to create that balance of releasing the bone minerals into the bloodstream where it's needed for the body, also creating new bone. So that has to be balanced. Okay, so the estrogen regulates and prevents bone turnover in both men and women. The proteins RANK and RANKL in a cell signaling pathway are involved in osteoclast or bone resorption functioning. So the body makes so many thousands and thousands of different kinds of proteins that serve different purposes. But these two proteins here are involved in how your cells communicate electrically through the nervous system, through the hormonal system, through all the monitoring immune systems. All these systems are always signaling and talking to each other, letting each other know what's going on in the body. So these proteins are involved in letting the body know what's going on as far as if the body's producing osteoclasts or bone resorption, right? Okay, so yes, that's very important. Your body has to know what's going on. Is it giving out too many minerals into the bloodstream? Is it not taking enough minerals into the bones, kind of thing? So estrogen prevents or blocks the osteoclast actions, helping to preserve bone density. Okay, so estrogen, it's as if it's directed to either prevent or block, this process of releasing all these minerals into the bloodstream. So it actually ends up helping to keep more of your bone density. So males aged 60 to 85 engaged in a 12-month hopping exercise on one leg only to compare with the non-exercised leg. So this was a 12-month exercise program where these men were told to hop only on one leg. Okay, so an increase occurred in the bone mineral density of the one femur bone that was always receiving this impact, right? So impacting and jumping against gravity, that is going to put more minerals into the bones. And that was the outcome. That was the determination in these 60 to 85-year-old seniors. So it can happen at any age. So now remember the E2 estrogen that I mentioned early on. This particular estrogen regulates and prevents bone turnover in both men and women. So the RANK and RANKL proteins, they stimulate bone resorption. So they actually will help the bone density, right? Protect that. So here is a image of what happens here. So these are new bone cells that are forming, and these are the bone cells, and these are the forming sites where the body produces things like red blood cells and other things. So here's the E2, right? It's going to try to influence bone turnover, right? But the RANKL wants to take the bone minerals and distribute them out to the bloodstream. But the E2 says, no, you can't. So there's this constant, give and take, one against the other, creating that balance. Okay, so so these are the, excuse me, let me look at this chart again one moment here. Okay, osteoblasts. So that's going to be the ones that will absorb more minerals right into the bones. And the osteoclasts are the ones that are going to be releasing a lot of the minerals into, or the right amounts of minerals into the bloodstream, right? So these are the osteoclasts here, but the the RANKL and the RANK proteins are pulling them back, saying, nope, you can't. You can't go out there. You stay here and maintain the bone structure kind of thing. So it's really interesting. So the consensus of scientists on how often one should perform weight-bearing exercise are that if we exercise for 30 minutes duration, 3 to 4 times a week, then you're going to retain more of your strong bones. If you give muscles, joints, ligaments, and tendons 24 to 48 hours rest between sessions, then you won't be prone to injuries in those areas. So you have to give them rest and recuperation, give them time to replenish nutrients, repair the cells, because when you exercise, you're going to challenge a lot of your cells, and some of them are going to be damaged, but the body's very smart. It will replace those cells with new, better ones, more highly nourished ones, right? More highly functioning cells, giving you more endurance and more strength, right? And better health. So this process is really interesting as well, how the body reacts to the kinds of exercises that you do. For heavy weight training or extended endurance training, then give your muscles 3 days after your workout for resting. In the bodybuilding days, when I was lifting large poundages in the 80s, it took at least 3 days, and that meant paying close attention to the protein intake, the vitamins and minerals, the whole foods, all the above, drinking plenty of water, just to reload and for the next workout to be ready and rearing to go, right? Not necessarily dreading the workout, because when a person doesn't replenish properly, then they're going to dread going to the gym, dread their workouts. But if you replenish properly, you'll actually be like a racehorse. You'll be looking forward to that workout because you want to reinforce the success you've already had in getting in better shape. And, just rearranging the body fat, exchanging that for muscle and lean, shapely muscles, right? So it's not about just being narcissistic or anything like that. It's about how you feel when you're at that level. And it gets better and better the more consistent you are. All right, so overexercising, though, can result in reduced bone mineral density and stress fractures. This happens so often in the martial arts. I've seen it, and people that I know that are in other sports, they have seen it in their sports as well, that the young people aren't replenishing properly nutritionally. They're not getting enough rest. They're not hydrating properly. They're not getting the vitamins and crucial, essential minerals to replenish their bones, right? So they're getting stress fractures. They're getting more fragile. Our children and teens are not eating properly. They're eating too much of the nutrient void junk food out there. How can they grow, if they're not getting the nutrients the body needs to stimulate that process? So although any type of exercise can stimulate the retention of bone mass, weight resistance and weight-bearing exercises are the most effective. The higher the weight-bearing stress on the bones, the greater the response for retaining strong bone density. All right, so of course, seniors, if you have osteoporosis, of course, you're not going to go around and try to lift a heavy weight, right? You're going to break something, literally. So it's a very gradual process to have your bones be remineralized. So that takes time and that takes patience. So this osteoporosis condition happens gradually over time, and you don't really notice it until suddenly you find yourself, bent over. Your posture is not what it should be. You're not as strong as you used to be. You're more prone to injuries. You feel fatigued. All these clues are happening, but they happen gradually over time. So by the time something breaks, then that's when your doctors usually say, "Oh yeah, you're osteoporosis." But you can prevent all of that. Why get to that point when you can start a good exercise program just where you are? If you're debilitated, if you're immobilized, then move what you can. Increase your circulation, right? Even lifting a book is better than not lifting a book. I mean, it's getting to that extreme, but hey, if you're there, that's where you start, and that's where you can get better and better and better. So eventually you can get more mobile, you can start lifting a little heavier, graduate from 2-pound weights to 5-pound weights, and then later from 5-pound weights to 8-pound weights, and so on and so on. So never rush this. Always feel good about your movements. You don't want to feel totally wiped out after an attempt at getting circulation going and getting an exercise routine going. But yeah, if you can raise your arms, if you can, just slowly make very slow movements, don't do any fast twisting movements, things like that, because at this point you're probably extremely fragile. So, but those of you who are younger and are at the beginning stages of osteoporosis, and you have more mobility, of course, but also, you might still be prone to injuries. So be very, very careful and work with your physician, work with an exercise or therapist, physical therapist. Okay, so regular habitual physical activities have many health advantages. It improves your heart and your lungs, cardiorespiratory fitness. It improves your muscle strength. And when you improve your muscle strength, you're improving your bone strength as well and your bone density. That just goes hand in hand. Body balance and reaction time. So those who have osteoporosis or very weakened bones have trouble balancing. Sometimes, they'll find themselves, oops, I stepped this way, caught myself kind of thing. But that increases over time. And your reaction time too, because minerals help you respond quickly, helps send the electrical signals to the brain and those are lightning fast, right? If you're not getting enough of those signals, then you won't be able to react in a timely manner to prevent yourself from getting hurt. So it prevents falls and fractures. So exercise safety precautions for severe osteoporotic conditions. And again, let's go over the precautions here. It's very important that you don't hurt yourself trying to get stronger. That's, that's very counterproductive, right? So an exercise protocol for seniors requires precautionary measures to ensure against exercise injury. Always check with your medical doctor for providing the appropriate laboratory tests to evaluate your level of bone degeneration. If you have osteoporosis, don't do the following types of exercises. High impact exercises like jumping, running, or jogging can lead to fractures in weakened bones. Avoid jerky, rapid movements. Choose exercises with slow, controlled movements. If you're generally fit and strong despite having osteoporosis, you might be able to do somewhat higher impact exercise than someone who is frail. Bending forward at the waist and twisting at the waist can increase the risk for broken bones in the spine. Avoid touching your toes or doing sit-ups. Avoid activities that require you to bend or twist forcefully at the waist, like golfing, tennis, bowling, and some yoga poses. In the cases of fragility in osteoporotic patients, licensed medical physical therapy in a therapeutic setting is warranted. Again, go through your medical doctor and check with that person first. Therapists assess the preliminary abilities of their patients or clients to determine a careful therapeutic protocol, like balance and posture, movement, how mobile is the person. And also, of course, they're going to need the medical history. So researchers have found that a multi-component therapeutic exercise program comprised of slow and smooth movements progressing to resistance and low impact exercises produced results indicating improved physical abilities and reduced morbidity and mortality rates of osteoporosis. In those capable of advanced movements, progressive measures that included a program of both weight resistance and impact exercises proved to be an effective strategy for lowering risk factors. Nutrient density for bone recovery and maintenance. Nutritional factors for bone density are critical in the early years, which determine skeletal mass density that outweighs resorption in the elderly. Again, another kind of redundancy, isn't it, for tonight? But this is, again, other researchers who have come to general consensus with the scientific community. So you have peak bone mass is reached around age 30, where equal rates of new bone formation and resorption have been occurring. After the peak bone mass period up to age 30, at age 30, the rate of resorption begins to exceed formation and bone mass slowly decreases, but not if you're weight training, not if you're highly nourished, not if you're replenishing your minerals. You can last a lot longer with a lot stronger bones well into advanced years. Bone microstructure formed in early years of life influences the risk of fractures in later years. So if your bones were weak as a child, then it's a little bit difficult to catch up. Now, these are statistics based on people who didn't do any weight training, didn't exercise, right, throughout their lives, because that absorption happens all the time. And if you're constantly feeding your body the right nutrients it needs to build new bone, then of course that's going to override a lot of that history. Dietary and supplementary plant-derived minerals. And notice I say plant-derived minerals in the supplements. So don't bother with cheaper supplements because they're not absorbable and they can cause inflammatory responses because your body can't absorb them and tries to eliminate them because it can't use them. So you have the whole food form of minerals that are much more utilizable and much safer. They don't cause an inflammatory response, quite the opposite, right? They help build new tissues. So the bone microstructure that's formed in early years of life influences the risk for fractures in later years. So dietary and supplementary plant-derived minerals like calcium, phosphorus, magnesium, and zinc work together to maintain bone mass. And these are just a few of the major minerals that the body needs. And it also needs a lot of the other minerals and the microminerals as well, all in whole food complexes, not isolated supplemental form. Animal-derived complete amino. Oh, by the way, the organic whole food multi-mineral, multivitamin supplements that are on the market are pretty good. So those are something you could supplement your regular diet, which is also nutrient rich. Okay, so you want absorbability in everything you're putting in your body, including your supplements. So animal-derived complete protein amino acid protein. Protein has a vital role in maintaining strong bone density. So if you don't get enough protein, you're not getting enough phosphorus, and phosphorus is required for building bone density. Vitamin D3 or cholecalciferol, the kind your body makes when you're out in the sun, you can supplement with that too. You can buy supplements just to make sure you're getting enough of it. And again, just follow the doses on the labels, which I always say, and don't overdo any of the vitamins A and D and the fat-soluble vitamins. Make sure that they're in whole food form or in natural form. In this case, like in vitamin D3, the cholecalciferol that your body makes. Okay, so nutrient replenishments require daily for bone mass maintenance. At about 80 to 90% of bone mineral content is composed of calcium and phosphorus. The body stores about 1,000 grams of calcium. 99% of that is in the bones. We literally walk around relying on the body's calcium reserves. About 1/5 of dietary calcium is absorbed in the small intestine and requires vitamin D to make it utilizable. Regulating hormones aid in body calcium and phosphorus homeostasis, helping to maintain the right balance of osteoclast bone resorption and osteoblast new bone formation. Phosphorus is involved in the synthesis of proteins, energy production, and metabolism. It's involved in cell signaling. It's involved in cell apoptosis, and that's the appropriate cell destruction of aged cells or cell turnover. Insufficient phosphorus can block the formation of new bone, resulting in rickets and delayed growth. Rickets is recognizable by bowed legs. Deficiency can result in osteomalacia. That means softening or weakening of the bones because of inadequate mineralization in the later years. Calcium intake prevents the natural decline in estrogen levels, which helps reduce calcium losses through kidney filtration and the gastrointestinal tract and the skin. Protein, animal-derived, are foods high in phosphorus. Minerals, calcium, phosphorus, zinc, boron, copper, iron, and magnesium. Vitamins A, B complex, C, D, and K. Vitamin D is a precursor to the production of estrogen and androgen hormones that stimulate bone formation during childhood and puberty. Vitamin D also helps prevent low estrogen levels that lead to increased risk of osteoporosis and bone fractures, especially in postmenopausal women. The combination of vitamin D and calcium has been found to enhance bone density through numerous controlled studies on elderly women with osteoporotic fractures. It also is reduced body sway and balance when you have, all these nutrient replenishments that are necessary for the success of and preventing things like body sway and balance, and also the complete array of vitamins and minerals, especially minerals, prevented falls and subsequent fractures. So anyone who's on a good supplement regimen will not experience a lot of these problems. So organically grown whole foods from nutrient-rich soils free of genetically modified organisms, those are the GMOs, or pesticides, herbicides, contaminated soils, and groundwater from environmental, industrial, chemical pollutants. So, you want foods that are not contaminated by all these things. They are known to destroy so many of the body systems, the major body systems, like the nervous system, the hormonal system, the cardiovascular system, the digestive system, the immune system. All of these toxins are all over the place. So we have to focus on organically grown foods because they contain much, 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 much less of these contaminants, because you can't keep them out of organic farms entirely because they're pesticide drift in the air. A lot of the polluted waters, are in the areas where organic foods are grown. So by minimizing all of these toxins in the crops themselves and in the environment that they're grown in, then you're going to really minimize that. And if you're eating organically grown foods, like the ones you see here that are listed, they're going to have many antioxidant or cleansing, detoxifying properties. The raw fruits, the berries, the leafy dark greens, the different herbs, the brassica vegetables like broccoli, cauliflower, Brussels sprouts, and asparagus. It's not really a brassica, but it's lumped in there usually. It's actually from the Asparagiaceae family. Asparagus, like other things too, like agaves and yuccas, they're part of the Asparagiaceae family. So root vegetables, potatoes, carrots, and beets are examples there. Beans and legumes, all kinds of beans and all kinds of other types of legumes, like lentils, peanuts is a legume, surprisingly, but there's all kinds of other legumes. Beans are a legume also. Then we have 100% whole grains, cereals, flours, and breads, raw nuts and seeds. Notice I don't say roasted, salted, sugared nuts and seeds. These contain the omega-3 fatty acids, and they're very highly reactive to oxygen, so you have to keep them refrigerated in airtight containers. So that way they're very effective omega-3s. So then we've got multi-nutrient, whole food-based supplements, and I'm going to take you to my supplements page on my website. I've done research on supplements for 45 years, and I've always followed the industry and have seen how it has progressed in how it produces supplements and how companies source their ingredients. So much has improved over the last 4.5 decades in supplements, and I have the best one I could find that I always offer to people, and they love it. They really feel the difference when they take these supplements because they're in whole food form and very, very absorbable and available in the body. So, you've got an organic whole food, multiple vitamin, mineral, plant, phytochemical, or phytonutrient complexes in the plants themselves in this supplement. Also, I always have people add coral calcium because no matter how good a supplement is, it's usually a little bit short on the calcium. And the type of calcium you want are like the whole coral nutrient complexes that science has shown that coral calcium is the most bioavailable, most utilizable form of calcium than any other form of calcium. So naturally, I want only the best for everyone out there. So that's what I have people order. This source of calcium is highly absorbable and reduces the risk of kidney stones, renal calculi accumulations. Since it is in whole food form, it's not going to be an isolated form of calcium that accumulates in the blood and the kidneys have trouble filtering out, right? Always follow dosage recommendations on product labels to avoid hypercalcemia. That means the accumulation of high blood calcium levels. Also, I have people take a whole food vitamin C complex. There's that word complex. Whenever you have a whole food, you have a whole complex of vitamins and minerals in there, not just isolated synthetic forms or elemental forms of minerals, but those are not digestible at all, not utilizable at all. So you want whole food complexes, and the vitamin C I offer has that. And also, you can take vitamin D3, the cholecalciferol, which is the same, hormone-like vitamin that the body produces in sunlight. So those are the nutrients that are the fundamental nutrients that I put people on. That's the very basis for the kinds of things you want in your body. I'll come back to that link to show you my supplements in a moment here, but I'm nearing the end to this presentation. I wanted to show you just to get a nice visual of these wonderful, delicious foods that are so healing and so good for you and so good for your bones and muscles and nervous system and everything. So you can see on the left here, these are labeled calcium-rich foods, right? And this is just a few, many. If you grow something in an organic, nutrient-rich soil environment, then you're going to have minerals, higher mineral and calcium content in all kinds of crops, right? But these foods have a definite capacity to absorb a lot of calcium into their systems. So now we have phosphorus, all the protein foods, and some of the plant kingdoms like the nuts and seeds. They contain phosphorus, which is equally important for building strong bones. And then, of course, you have other, whole food vitamin and mineral complexes and these wonderful plant chemicals that are so abundant in the plant kingdom that are so cleansing and detoxifying and aiding so many different systems in the body. So yeah, eat a whole variety of these wonderful types of foods as well. They're high water content foods, they're enzyme active, and enzymes are so important for breaking things down in the body and rebuilding things back up again. So you need enzymes all the time. Okay, so I always back myself up, as I say, with scientific references. I do extensive research before I do these presentations every week, and I set them here for people to peruse on their own and do further research and do their own homework as far as knowing exactly how these scientists arrive at their conclusions, how they conduct their studies. It's so fascinating. All right, so these are, and of course, I do get a lot of my information from books I've already written because I've spent months and years researching and writing the books. I'll show you my book page in a moment. Okay, so these are the books that I've written, and you can find them at my holisticchoices.com website, and just click on the left link that says Books by Mary Esther Gilbert. So there's the whole URL there. But nutritional synergy, you know, if you want to learn how to eat a huge array of very healthy foods, and you'll learn how to put them all together to provide your body with the maximum, highly nourishing body that you deserve. You know, my nutritional synergy system that I created over the years has been very, very good for people to recover their health and to maintain their healthy body weight and all that kind of thing. So my nutritional synergy system is, I think it's the only system in the world that breaks different types of plant foods down into the types of phytonutrients that they have and how they address different areas of the body's needs. My Potent Superfoods for Lifelong True Health, it's like a really thick, 600-page book. And I spent months and months researching that. And there's a lot of science in that book, but it has 109 botanicals that you can use in your everyday life. And you'll learn all about all the different wonderful things that each botanical does for the body. And then I wrote is Eating for Physical Power and Stamina for those of you who want to maintain lean body mass and get rid of the excess body fat. You need some body fat, but not excess, right? And you can be strong looking and slim and, have just a lot of energy, right? And look fabulous. So this is my Eating for Physical Power and Stamina. So anyone who wants to, anywhere from a serious athlete wanting to gain more muscle mass to someone who just wants to lose the fat, right? And get stronger and look better. So this book would be perfect for everyone because the principles are the same. All right, so now the True Health Mastery is like a primer and introduction to holistic health. And so if you follow the advice in this book, then you'll get somewhere. You will learn what foods are bad for you, which ones are good for you. It's not as extensive as my Nutritional Synergy book, but this is a good introduction and it will get you started, certainly. I also wrote a book on how to select the right nutritional supplements. Okay, so please subscribe to my channel if you haven't already, and like it. It puts the video algorithm, the algorithms for this video in front of many, many more people who are desperate for this information. You could save a life out there just by hitting the like and subscribe. And if you feel like sharing the video, even better. Okay, so to become a member of my institute, if you like what you've heard tonight, if you want more information all about how to master your health, all the different things you need to know to protect your health and to actually take action to improve your health rapidly, then you can join the True Health Mastery Institute of Holistic Personal Health Management. I will go through my website and I will show you how to do all these things that I introduced to you tonight. And if you'd like to take my Nutritional Synergy course based on my Nutritional Synergy book, that's, double the power. You can take the course without reading the book, or you can read the book without taking the course. It'll give you, different perspectives on how to build your health. But if you put those two together, the course and the book, then you will become more of an expert than 90% of the people out there, including your medical advisors or even your nutritional advisors. So this is as a result of years and years of scientific research and seeing the results in my clients and my students and my readerships, all the people who have implemented this program in their life, and has just it's like automatic. You're so well nourished, and you pick and choose from the different categories in the system, and you're automatically highly nourished, and your body responds by getting better. Okay, and your body knows what to do once those nutrients are in the body. All right, so this is my system here. So let me go back to my website. I'm going to share my website here. This is the home page. And so if you scroll down, if you'd like to send me a message, if you have any questions, then you can always contact me. Click on the contact link on the left, and you just put your name and email and type your messages and send it away, and I'll be happy to help you with any questions you might have. The True Health Mastery Institute, then if you read all of the perks and advantages of being a member, I treat my members like gold, because not very many people are going to dedicate their lives themselves to not only improving their health, but improving the health of others. So you don't have to be a practitioner or anything like that, but if you are interested in elevating your health and elevating your life and preventing all the degenerative diseases that come with lack of nutrition, nutrient deficiencies over time, where the body starts breaking down because it doesn't have what it needs to repair and replenish itself. Okay, so this is all about how to master your health, master your nutrition, master your fitness, and you'll see how it carries over into other areas of your body, of your life. Other people have said that it enhances their spirituality, it elevates them to higher places in their life, relationships have improved. So this is not just about being physically healthy, it's about being a whole health person, reaching your higher potential in every way. So that's been my experience in how people have utilized my system and actually improved their lives and their health and saved their lives and save the lives of others. So if you'd like to join the Institute, you just go to the holisticchoices.com, you click on True Health Mastery Institute, you'll land on this page and scroll down halfway, and you can always click the Join Here button. If you're already a member, you can log in and just peruse the member area that has articles and videos, and all kinds of wonderful information that you could get lost in that library area. There's so many different things to explore in the member area. But once you join, you'll get a link, and you'll use that link to access your member area. You create your own password, and you keep track of everything that you're doing as a member in that back area. Okay, all right, so now if you'd like to look at my books, again, you go to the left menu, click on books, and you land on my author page. And here are the books that I've written. They are in hard copy form, and you can also get them in ebook form. Most of my books are on Amazon, so the ebook form would be the Kindle, and you can download the Kindle to your computer or your device, for free if you choose to get the ebook. I always make a video to explain what's in the books. So here's a video explaining it, and I always give you a brief description of what the book is about. Okay, so yeah, I just make a video for each one of my books so that you can just kind of not have to judge the book by its cover, right? You can kind of get an idea of what you'll be getting. So people are very, I've gotten 5-star reviews on a couple of my books, and so it's worth your time to add this to your home library and just refer to it as much as you can or as much as you need to. Okay, so that is pretty much wraps it up. I think I got everything. All right, I'm going to stop my share for you. Okay, so thank you so much for being here. This is a little bit longer than I usually go. Usually I try to make it under an hour, but there was so much information on saving your bones that I wanted to get this information out there to you. So if you made it this far, congratulations. Sometimes people only watch a little bit of it and say they're going to come back to it with every good intention, of course, but do they come back to it? The world is so full of distractions, right? But if you have it in the background, you can hear me talking, that's a good way to listen to all my videos as well. But if you have time, you can gather some people together who want to improve their health and just make it a weekly thing. If you join the True Health Mastery Institute, you can join me and my members every Friday night for the live, and you can ask questions even after the video recording has been turned off. Then that's when the members and I just interact more, and I get more questions answered, and I can provide more answers for the members in all of their health concerns or any other question they might have concerning their health. Okay, so thank you so much again for being here. Please like, share, and subscribe. That really helps the channel. I'd like to get the word out to as many people as possible. So not only would it help you with your health, but you would also be thanked by many people who actually have implemented, will go ahead and implement, all the information that I have to offer here. So best wishes for your optimal health vibrancy, and I hope to see you again. Thank you for returning YouTube subscribers. Thank you for being here, and I will see you all next time.